I've always been curious about which is more painful, a cesarean section or a natural childbirth. Let's first take a look at the principle and process of a natural childbirth. Natural childbirth may sound like a simple term. However, its pain level is no less than having 10 ribs broken simultaneously. First, under the effect of oxytocin, the uterine muscles of the parturient will start to contract rhythmically. In order to ensure the smooth delivery of the baby, the cervix will gradually dilate at this time. Some can even reach an astonishing 10 centimeters. After the cervix is fully dilated, the baby's head begins to slowly enter the birth canal. The pain level at this time is still bearable compared to what comes later. A few hours later, when the baby's head touches the pelvic cavity, this is also the most painful stage in the process of natural childbirth. Because the average width of a woman's birth canal is about 3 centimeters, while the width of a baby's head is often around 10 centimeters. At this time, if the birth canal is too narrow or less than 10 centimeters, it is very likely to cause the baby to suffocate in the birth canal. So, in order to ensure the smooth delivery of the baby and prevent excessive tearing of the birth canal, the doctor will perform an episiotomy on the birth canal to facilitate the smooth delivery of the baby. Even after the baby is completely separated from the mother's body, it's not over yet. The doctor still needs to remove the placenta from the uterus. This process will last for about 15 minutes. It should be noted that if the placenta cannot be expelled normally, the parturient is very likely to experience the more painful process of manual removal of the placenta than childbirth. The doctor will remove the placenta with their bare hands. It's like tearing off a piece of meat alive. You can imagine how painful this process is. Next, let's take a look at a cesarean section. First, a comprehensive examination will be conducted on the parturient before the delivery. The size of the fetus and the position of the head will be determined through an ultrasound. After all the indicators are normal, then the doctor will use a urinary catheter to empty the urine in the parturient's bladder. The main purpose of doing this is to create more space for the upcoming surgery and avoid scratching the bladder. Next comes the anesthesia. Generally, there are 2 types of anesthesia: general anesthesia and intraspinal anesthesia. However, the former is very likely to affect the fetus's breathing through the placenta and cause respiratory depression. Therefore, intraspinal anesthesia is usually chosen in most cases. At this time, the anesthesiologist will insert a needle in the middle of the lumbar vertebra and inject the anesthetic. After a while, the lower half of the parturient's body will completely lose sensation, but the parturient will still be conscious. Then the doctor needs to disinfect the abdominal wall. Immediately after, an incision is made on the abdomen. After cutting through the skin, subcutaneous tissue, and fascia and other tissues in turn, the abdominal wall is opened to enter the abdominal cavity. After ensuring that both the abdominal cavity and the uterus are normal, then a cut also needs to be made on the uterus. After the uterus is incised, the amniotic membrane is then punctured and the amniotic fluid is suctioned clean. At this time, you can see what the baby looks like through this incision. Then the doctor will reach into the uterus and take out the fetus. After that, the umbilical cord connecting the mother and the fetus is cut. After the placenta is completely removed, cleaning and hemostasis are carried out. Finally, the incision is sutured. In this way, your mother endured so many incisions to give birth to you. So, which do you think is more painful, a natural childbirth or a cesarean section? Subscribe for more.